Welcome to the Atlantic Health System's Newton Medical Center. Thank you for choosing Newton Medical Center to help you welcome your new baby. Whether you're a new mom or expanding your family, our obstetricians, neonatologists, nurses, pediatricians, and the entire support team at the Maternity Center are ready to assist with a safe and comfortable delivery. You will receive superior, personalized, warm treatment with advanced technology in a safe environment. To keep all our moms, dads, and support people safe, we invite you to watch this video to introduce you to our award-winning Maternity Center and team in lieu of an in-person tour. If you have any questions, our maternity care team is available by phone. As you are preparing for your childbirth at the hospital, we have a list of recommended items to make sure you bring for both mom and baby. After the initial delivery period, most women prefer their own items. There are also essential items that you must have in order to take the baby home. It's best to plan ahead. And remember, you will have to have an approved car seat before discharge. When your labor begins and your obstetrician has instructed you that it's time to head to the hospital, your support person should drive to Newton Medical Center and drop you off at the main hospital entrance utilizing the Stork parking space. They should then park in a free visitor parking lot. A health assessment will be performed at the main entrance for everyone entering the hospital to screen for COVID-19 symptoms and other infectious disease. This will include a temperature check and standard questions about symptoms, travel, and contact with sick people. Upon entering the hospital, you are required to wear a mask at all times, including in your room. All Atlantic Health team members will wear masks at all times. We strongly encourage you and your support person to practice hand hygiene by washing your hands frequently and using the gel sanitizer that is available in your room and throughout the hospital. Once you have been screened, you will proceed through the main lobby and take the elevator up to the single-room maternity unit. This is a secured unit, so you must ring the bell for entry. Upon arrival to labor and delivery, our team will do a second temperature check and screening. Then, upon entry, they will bring you to a triage room to make sure your registration is in order. Pre-registration paperwork is available upon request to make your registration process more efficient. Please bring your photo ID and insurance card for the registration process. Your support person will be given a security band at this time. All patients can designate one healthy support person to be with them for the delivery of their baby and their postpartum stays. Certified doulas are currently permitted as part of the patient care team and do not count as a support person, but is subject to change. Please contact your provider as your due date approaches to confirm. We are following New Jersey DOH guidelines for COVID-19 testing in our maternity centers. Please contact your OB provider for details 2 weeks prior to your due date, as these are subject to change. Women who have scheduled C-sections or scheduled inductions will have a COVID-19 test done prior to the procedure and quarantine from the test to their admission. We encourage designated support people and doulas to get tested independently prior to the childbirth, but it is not mandatory. All patients who test positive for COVID-19 are placed in private rooms in a special COVID-19 area of the maternity unit that is isolated. Our maternity center has a designated labor and delivery triage area. This designated triage room helps our care team members tend to all of our patients' needs during the various stages of their entire pregnancy and labor. Based on the physician's orders and the patient's medical condition, some women in labor might utilize a triage room first for labor evaluation, while other women will go directly to a labor and delivery room. After registration, you will be brought to your designated room, where you will meet your nurse and other members of your care team. They will go over your prenatal history and admission questions. To ensure we have all of your necessary information and for your safety, you may be asked some of the same questions you have already been asked. Your nurse will take your vital signs, draw any needed lab work, and connect you to fetal monitoring to assist both mom and baby. At Newton Medical Center, we offer a single-room maternity unit, meaning you will stay in one room for all your labor, delivery, recovery, and postpartum needs. These rooms are private and include a bathroom, shower, and place for your support person to sleep. Our unit has laboring tools available like birthing balls, peanut balls, birthing bars, birthing stools, mirrors, and more. We have wireless monitoring and intermittent monitoring available during labor to allow for more flexibility in movement. Its use must be authorized by your healthcare provider and can be implemented after at least 20 minutes of traditional or wired monitoring in the bed. During your prenatal care with your OB provider, talk to them about pain management options and birth preferences. Our maternity center has an anesthesiologist available 24/7. If you are having a scheduled cesarean section or C-section, you will advance to the preoperative area after you have registered. One designated support person is allowed to attend in the operating suite. Our labor and delivery is equipped with an operating room. Our pediatric team is present at all C-section deliveries. All women who have scheduled C-sections must have a COVID-19 test prior to the procedure and quarantine from the test to the operation. All patients who test positive for COVID-19 are placed in designated COVID-19 rooms in a special area of the maternity unit. We are a baby-friendly certified facility, which means we encourage certain practices, such as approximately 1 hour of skin-to-skin contact on mom's chest right after childbirth once you are both deemed stable. This can be wonderful bonding time. If you have had a C-section, skin-to-skin can take place after your surgery. After that, the medical team will do standard baby checks right in the room with your family, including height, weight, footprints, and measurements. Baby will also get their security band at this time. You will also be supplied with all your postpartum and perennial care bathroom needs during this time. Should your baby need closer observation and care due to medical concerns, he or she may go to our newborn nursery or transfer to our intermediate care nursery. Room service menus are available during your stay with a variety of options to choose from. This menu can meet any dietary or allergy restrictions, as well as personal preferences. There are snacks and nourishment on the unit at all times. The hospital also has a cafeteria that is accessible during your stay. After your baby is born, one of the newborn nursery nurses will come to your room to complete your baby's measurements and assessments. A Newton Medical Center pediatric hospitalist will come to see your baby and is available 24 hours a day. If your pediatrician does not have privileges at Newton Medical Center, we have pediatric hospitalists who will come to see your baby during your stay. There's a pediatrician on staff at the maternity center 24 hours a day, 7 days a week. They will then discharge you into the care of the pediatrician of your choosing. Your LDRP nurse will care for you as a couplet. Rooming in with your baby is encouraged to support bonding with your baby as well as the many other benefits unless otherwise requested. Pediatric visits, baby's first bath, consultations, baby's blood work, and other supportive services can all be provided at bedside. If you wish to breastfeed your baby, our nurses are highly trained and able to assist you. Hospital-grade pumps are available for your use while you are here. Before you go home, we will give you all the education you need, as well as resources and products to help you be confident and informed new parents. After you go home, we will still be here for you. Call us if you have any questions. Congratulations, and thank you for entrusting us with your care. Newton Medical Center is focused on providing a safe and comfortable childbirth experience for all of our moms. Some amenities may not be fully available as we address COVID-19 in our communities. We appreciate your support and wish you all the best for your growing family. Please contact our patient liaison with any and all follow-up questions. We are here for you. Any footage in this video with team members, patients, and support people who are not wearing masks were obtained prior to COVID-19. This does not reflect the universal masking requirement which is in place for every person in our medical centers.